Do we have her card? Oh, perfect. So first we have Barb Hiltz, who is an LMSW. She's a clinical associate professor and Master of Social Work program director at the University of Michigan School of Social Work. Barb, come on up. And we will have 3 minutes. I appreciate that. Thank you so much.
I'll get started right away. I am honored to come to speak in support of the Licensure Modernization Act. My name is Barb Hiltz, and I'm the director of the MSW program at the University of Michigan School of Social Work. Our school provides a Master's of Social Work degree program accredited by the Council on Social Work Education and follows a rigorous program of study. For the reasons I'll describe today, the proposed changes will better enable qualified professionals to secure social work jobs that meet the needs of vulnerable residents of Michigan, as well as in other areas of the United States. So first, this legislation provides alignment with the licensing tiers of those in other states. The majority of our students at Michigan, around 60%, are Michigan residents, which means that about 40% are from other states where they may eventually seek licensure. By modernizing the licensure tier structure to the LBSW, LMSW, and LCSW, our licensure system will parallel that of other states and more seamlessly enable social workers to move into and out of Michigan, but also to perhaps hold licenses in multiple states in order to, for example, practice telehealth without confusion regarding the equivalence of licensing credentials. Second, this legislation removes Michigan's reliance on a licensing examination that has known disparities, and we heard testimony of that today, and I understand there's been previous testimony as well. Third, and connected, the pass rate disparities are present even under the most favorable of conditions. So at our prestigious university, at the University of Michigan, our overall pass rates are higher than the national average, yet still the pattern of disparities is present, despite the significant supports that we provide to all students. One could argue that students in our top-ranked program are best positioned to pass the exam. And the fact that the pattern of disparity is present even under this best-case scenario lends credence to the view that the ASWB exam is systematically flawed. And then fourth, simplifying a path to licensure and eliminating the testing requirement will facilitate growing the workforce at a time when that is desperately needed. Experts have projected a workforce shortage of upwards of 200,000 nationally, forecasting a crisis in the ability of professional social workers to serve children and families, elderly people, and people with mental health, substance abuse, and other health issues. In fact, right here in Michigan, more than 500,000 people have an unmet need for mental health treatment. Social workers represent the largest group of providers of behavioral health services in the nation, and therefore removing the barriers to licensure is a concrete step that you can take towards addressing unmet needs here in Michigan. In closing, I ask for you to support the Licensure Modernization Act and ensure that the residents of Michigan have access to professionals who provide counseling, support, advocacy, and systems change for the betterment of our state. Thank you.
Thank you so much. Colleagues, any questions? Thank you for your testimony. We appreciate it.